Medurstand. Understanding medicine.
Professor Aziz Rehman from Medurstand, and now I'm going to demonstrate how to elicit some of the superficial reflexes that is part of neurological examination. And there are many of them, but most important are two, I think. First is abdominal. You have to expose, ये थोड़ा सा मैं ऊपर कर लूँ, this part, थोड़ा सा नीचे करना है इसको, okay. So what we do is that we gently strike the abdominal wall, and as a result this abdominal wall muscle, they will contract, and we do it in the four quadrants: this part, this part, this part and this part. And it is not easy test to do. There are people who have very flaccid abdominal wall and you can't see any muscle contraction. So in a normal healthy person you may not be able to elicit this sign, but the technique is you use this part of the hammer, and this could be very sharp sometime, and this one is okay. So you make a sharp movement from out inward toward the umbilicus in all four quadrants. I'm going to do this one, this one, this one and this one. I think it is best to move from out to the inward motion like this one, and please see if you can see the movement here. So there was contraction of abdominal muscle, right? So whichever quadrant I strike, there's a contraction of that muscle and the umbilicus moves toward that, and this reflex is lost in upper motor neuron lesion and may be very difficult to elicit. The other superficial reflex is this plantar reflex, very important. Normally we have to hold it like this, and we strike this pointer from starting on the heel, moving this way along the lateral surface, and then we move across the ball of the foot and ultimately come to the big toe. I think with experience you need to learn how much pressure you have to exert. Very superficial. If you be very gentle, this could be very superficial and that might not elicit the reflex, and you of course don't want to be too hard and you don't want to end up causing injury. So this is how I do it. In a normal person, what we expect is flexion of all the muscles, all the toes, flexion. So that is a normal flex. Now see how I do it. See, I could end here also if I see the flexion, but normally I have to come like this. This is the normal downgoing plantar reflex. On the other side also I do it. See, this is flexion of all toes is a typical. Now in some cases when I do the same, there could be extension of the toe and fanning out of the fingers. Let me see if I can demonstrate this. This thumb would move upward and these fingers would fan out. This is called Babinski signs or upgoing plantar reflex, and this typically indicates upper motor neuron disease. Again I say that it has to be considered in the proper context. If patient has features of paralysis, then if Babinski is positive on one side or the plantar reflex is upgoing on one side, that would indicate upper motor neuron paralysis on that side. Then other reflexes, if there is cremasteric reflex, and if we touch the inner side of the thigh, there would be contraction of the testicle, the scrotum, and there would be elevation of the scrotum on that side. That is one. And the other one is anal sphincter. If you touch on the side of the anal verge, and there should be contraction of anal muscles. So that is another one. Then there are some primitive reflexes. There are also superficial reflexes, but we don't do it normally. So if I press it here, if I press on the finger, if patient presses like this, that's a primitive reflex. Similarly, if I touch on the side of the lips and patient starts doing the sucking movement, That is also a primitive reflex.
The primitive reflexes become positive in severe cerebral atrophy.
So that was all about the superficial reflexes. Thank you.